Welcome back. Being fat triggers a troublesome immune response to COVID-19, scientists in the UK say. But please, before I continue, if you have not subscribed to the channel, just subscribe now. Thank you. Scientists advising government ministers are exploring potential underlying mechanisms that could increase the risk of death for obese patients. According to data from intensive care units, people of a healthy weight make up a minority of critically ill COVID-19 patients. Almost three-quarters are carrying extra weight. An NHS hospital data this week revealed obesity raises the risk of dying from coronavirus by nearly 40%. While the reasons remain unclear, scientists have warned of a potential dysfunctional immune system that makes fighting the virus more difficult. Fat cells, of which there are more in the tissues of obese people, may harbor vital immune cells, reducing their availability in the rest of the body. Or it may swing the other way. The immune response may go into overdrive, known as a cytokine storm, which is thought to play a major role in COVID-19 death. There hasn't been data to suggest obese people are more likely to catch the killer virus in the first place. The Sunday Times reports that the SAGE committee will investigate the relationship between obesity and serious COVID-19 illness. As the death toll of the virus in the UK reaches more than 28,000, data collected from NHS hospitals has revealed those most at risk. It includes those with obesity, those with underlying health conditions, and people of BAME background. Men also account for more than 70% of patients. There are a higher proportion of people with obesity in critical care than in the general population. According to the Intensive Care National Audit and Research Center, which collect data from NHS hospitals, the figure released on Friday are based on a sample of 7,542 critically ill patients confirmed as having COVID-19. According to the ICNARC report, people of a healthy weight make up a minority of critically ill COVID-19 patients. Almost three-quarters, that is 73%, are carrying extra weight. Some 35% have a BMI between 25 and 30, that's body mass index, which is regarded as overweight by the NHS. 31% are obese, and just other 7% are severely obese. For comparison, in the general population of England, 64.3% of adults are either overweight or obese. Data from 2019 shows it. There are more morbidly obese people in critical care than in the population. A lecturer in cellular and organismal metabolism, University of Reading, Dr. Dian Selaya, said, "What we know from the data so far is that obesity is a clear risk factor for severe disease. Studies have shown obese people are more likely to suffer serious complications or die from infections such as the flu. Doctors say the immune system of fat people are constantly ramped up as they try to protect and repair the damage inflammation causes to cells. Using all its energy fending off inflammation means the body's defense system has few resources left to defend against a new infection like COVID-19. The lecturer said obese people tend to have dysfunctional immune system. Their fat tissue, for example, becomes a reservoir for immune cells known as macrophages. While these cells reside in our fat under normal circumstances, in obesity they are at higher frequency and become more troublesome. They start to secrete inflammatory cytokines and negatively impact on immune and metabolic health. Obese people might eat a diet with very little fiber and antioxidants, which keep the immune system healthy, such as fruits and vegetables. Most patients with a BMI of over 40 suffer from breathing problems that range from simple shortness of breath to potentially life-threatening condition known as obesity hypoventilation syndrome, OHS. Excess weight also makes it more difficult for the diaphragm and lungs to expand and inhale oxygen. Starved of oxygen, organs will begin to fail. These factors may explain why obese people's lungs tends to fail faster when the new coronavirus strikes compared to a healthy person. COVID-19 kills by spreading deep into the lungs and causing complications such as pneumonia. There are several other factors that may increase an obese person's chance of falling seriously ill with coronavirus, including a lack of exercise. Studies have shown that physical activities increase the number of certain immune cells that help to bolster immune activity. Clogged up arteries also make it hard for blood-carrying immune cells to pass through and repair cells around the body. Obese people tend to have dysfunctional immune system. Their fat tissue, for example, become a reservoir for immune cells known as macrophages. Why these cells reside in our fat under normal circumstances? In obesity, they are at higher frequency and become more troublesome and negatively impact on immune and metabolic health. It is likely that the immune response to the virus is therefore ineffective in obese individuals. Studies have shown obese people are more likely to suffer serious complications or die from infections such as the flu because their immune system are constantly ramped up as they try to protect and repair the damage inflammation causes to cells. Obesity is one of the main risk factors for comorbidities, including heart diseases, diabetes, and high blood pressure, all of which have been identified as common medical conditions among COVID-19 patients. People with underlying health conditions are more vulnerable to serious illness from the virus. The analysis of 17,000 COVID-19 admissions found death rates were 37% higher among obese patients, second only to dementia, which is 39%, but more than heart disease, 31%. The research was conducted by a team of Britain's top infectious disease scientists who are part of the pandemic planning global body. Wow! A very nice information for all of you. So guys, if you have anything to say concerning this, drop your comment in the comment section and don't forget to subscribe to this channel. Thank you very much.